Chapter 9. Miscellaneous. 9-month follow-up appointment with St. Luke's Bariatric team. St. Luke's Hospital will have a 9-month post-operative session with you. All patients having surgery during the same month of your surgery will be invited to this session. This session will be held from 5:30 p.m. to 6:30 p.m. prior to the start of the regular support group. Use the space below to write the date of your session. Please mark your calendar and plan to join us as we review the pouch rules, monitor your progress, and take your questions. Non-steroidal anti-inflammatory drugs or medications containing them. You should take caution or avoid these medications as they could harm your pouch or sleeve. This is a sample list and is not all-inclusive. Please read labels carefully. Non-steroidal anti-inflammatory drugs. Advil, ibuprofen. Aleve, naproxen. Anaprox, naproxen. Ansed, flurbiprofen. Azolid, phenylbutazone. Bextra, valdecoxib, butazolidine, phenylbutazone. Celebrex, silicosib. Clonoril, Sulindac. Dolobid, diflunisal. Excedrin IB, ibuprofen. Theldine, pirosicam. Ibuprin, ibuprofen. Indocin, indomethacin. Lodine, etidolac. Meclamin, meclofenamate. Midol IB, ibuprofen. Motrin IB, ibuprofen. Nalthon, phenoprofen. Naproxen, naproxen. Nuprin, ibuprofen. Oridis, ketoprofen. Oravale, ketoprofen. Pamprin IB, ibuprofen. Ponstil, mefenamic acid. Rexulate, sodium thiosalicylate. Tandirol, oxyphenbutazone. Telectin, Tolmetin. Voltaren, diclofenac. Barbiturate, furanol. Butalbital, aspirin, caffeine. Salicylates, amagesic. Salsalate, anacin, aspirin. Arthropan, choline salicylate. Ascriptin, bufurate aspirin. Aspirin, aspirin. Aspartab, aspirin. Bufurin, bufurate aspirin. Disalicid, salsilate. Ecotrin, aspirin. Uracil, sodium salicylate. Analgesics. Equagesic. Meprobamate aspirin. Macranin. Meprobamate aspirin. Percodane. Oxycodone aspirin. OTC. Pepto-Bismol, Alka-Seltzer, Excedrin. For gastric bypass patients, extended releases medication, sustained release medications, time-released medications. My surgical experience, St. Luke's University Hospital. Thank you for choosing St. Luke's for your surgical procedure. We want to make sure your visit to our hospital is as comfortable and convenient as possible. Our expert surgical team will provide you with the best care and recovery. Please read the following instructions to prepare for your surgical procedure. Pre-admission testing. After your surgeon schedules your surgery, a nurse from Pre-Admission Testing (PAT) Center will review your medical information. Depending on the planned surgery and your history, you may be scheduled for an appointment in the PAT Center or the nurse will speak with you over the phone. Whether you have a PAT appointment or the telephone call, we will interview you to obtain detailed information about your medical and surgical history. Please write down the following information and have it available for your interview with the nurse. A list of all medications you take including prescription, non-prescription, vitamins, herbs, supplements, inhalers, eye drops, ointments. Also write down the dose, frequency, and time that you take the medicines. A list of all your known allergies and/or reactions you have had to any medicines. A list of all past health problems and operations. A list of any implant devices, example pacemaker or medical equipment, like an insulin pump. A list of any questions or concerns you may have about your surgery. The phone number where you can be reached the day of your surgery. In an effort to make sure you have the best experience, we will ask you about information that may already be in your record. This is to be sure everything is still accurate and up to date. If you do not receive a call from our PAT center to schedule an appointment or to speak with the nurse 1 week prior to surgery, please call the campus-specific phone number found on pages 8 and 9. Preoperative anesthesia interview. An anesthesiologist will review your history and may want to see you or have a further discussion regarding your health history and procedure. You will then have the opportunity to discuss any questions you might have regarding anesthesia. Day before surgery. On the day prior to your surgery, you will receive a telephone call from our staff to confirm your arrival time. If your surgery is scheduled on a Monday, the hospital will be calling you on the Friday before your surgery. If you haven't heard from anyone by 8 p.m., please call the hospital supervisor through the hospital operator at 484-526-4000. Warren phone number 1-908-847-6700. What do I need to do before coming to the hospital? Arrange for a responsible person to drive you to and from the hospital. Arrange for your children to be taken care of at home. Children are not permitted in the surgical recovery areas of the hospital. Plan to wear clothing that is easy to take on and off. Wear clothing that has buttons or zippers on the front. For shoulder or facial surgery, wear a button-down shirt. Stop smoking 2 weeks prior to your surgery date. You may not smoke 48 hours prior to your surgery. If you decide to smoke 48 hours before your surgery, you are at risk for having your surgery canceled. Do not drink alcohol in the 24 hours before your surgery. Do not eat or drink anything after midnight the night before your surgery. Do not eat candy, mints, lifesavers, chewing gum, or water. If your surgery is after 1 p.m., you may have clear liquids, black coffee, tea, 7-Up, ginger ale, gelatin, or broth, until 7 a.m. Do not have milk or juice with pulp. Follow specific instructions provided by your surgeon or anesthesiologist related to liquids you may drink or be required to drink before your surgery. Follow specific instructions you receive from your surgeon regarding which medicine you may take on the day of surgery. If instructed to take medicine on the morning of surgery, take pills with just a small sip of water. Remove nail polish, including gel polish and any artificial, gel, or acrylic nails. Remove all jewelry, including rings, and any body-piercing jewelry. Do not shave any body part in the 24 hours before surgery. This includes the face, arms, legs, and upper body. Do not apply any lotions or creams, including makeup, colognes, or perfumes to your skin after showering before surgery. What do I need to bring with me the day of my surgery? Photo ID and insurance card. Prescription drug card. Crutches or walker if you have them for foot, knee, or hip surgery. Any splints or immobilizers for hand, arm, or shoulder surgery. A list of the daily medicines, vitamins, minerals, herbs, and supplements you take, including the dosages and the time you take them each day. Glasses, dentures, or hearing aids. Minimal clothing. If you have a living will or power of attorney, bring a copy. If you have an ostomy, bring an extra pouch and any supplies you use. If you have an insulin pump, bring any supplies you use. If you have an implanted pacemaker or AICD, bring the card or contact information. If you are staying overnight and require a CPAP, bring your CPAP machine. Do not bring medicines or inhalers, money, valuables, electronics, and jewelry. What other information should I have about the day of surgery? You should notify your surgeon if you develop a cold, sore throat, cough, fever, rash, or any other illness. You will be asked to report directly to the surgery unit. location-specific details found on pages 8 and 9. You will be instructed to stop at registration only if you have not been pre-registered. Inform your driver that if they do not stay, they will be asked by the staff to leave a phone number where they can be reached. We may need to reach you on the day of your surgery. Please make sure the nurse knows what number we may call to reach you. The schedule may change and we may need to ask you to come in earlier or later than expected. Washing instructions. Preoperative showering instructions. Before your operation, you play an important role in decreasing your risk for infection. Washing your body thoroughly in order to reduce bacteria on the skin can help to prevent infections at the surgical site. Please read the following directions the week before surgery so you are ready. Week before surgery. If your surgeon instructs you to use a special antiseptic soap containing chlorhexidine gluconate, CHG, prior to surgery, you should obtain the soap at least 1 week before your operation. Common brand names include Applicare, Endure, and Hibiclens. CHG soap is available from some doctor's offices, St. Luke's Homestar Pharmacy, or most retail pharmacies and the PAT Center. If you are allergic or sensitive to CHG, please let your doctor know so another antiseptic soap can be suggested. If you are unable to purchase soap containing CHG, use regular soap as instructed below. Notify the nurse on arrival the day of surgery. Day before surgery. You will need to shower the night before and the morning of your surgery. You will need to prepare your bed and clothing so they are clean and ready after your showers. Place clean linen sheets on your bed. You should sleep on clean sheets after your evening shower. Get clean towels and washcloths ready. You will need enough for 2 showers. Set aside clean underwear, pajamas, and clothing to wear after your showers. Evening before surgery. The evening before your operation, take your first shower. Shower 1. First, shampoo your hair with regular shampoo and rinse it completely before you wash your body. Next, wash your body from head to toe with soap and a clean washcloth. If you were instructed by your surgeon to wash with the CHG soap, use 1/2 of the bottle of soap for this shower. You will use the other half of the bottle for your shower in the morning. Do not get CHG in your eyes, ears, nose, mouth, or vaginal area. If you are using regular soap, try to use a new bar if possible. Pay special attention to the area where your incision will be. Lather this area well with the CHG soap for about 2 minutes. Do not use any other soap or body rinse on your skin during or after the antiseptic soap. Rinse yourself completely with running water. Use a clean towel to dry off. Put on clean underwear and clothing or pajamas. Sleep on clean bed sheets and linens. Reminders: do not use lotion, powder, deodorant, or perfume or aftershave of any kind on your skin after your antiseptic shower. Do not shave any body parts in the 24 hours the day before your operation. Day of surgery. The morning of your operation, take your second shower. Shower 2. Follow the same steps as shower 1. If you were instructed by your surgeon to wash with CHG soap, use the second half of the bottle of CHG soap. Where to report. Please see pages 8 and 9 for location information. Anesthesia. At St. Luke's, anesthesia is chosen to fit the patient's surgical and personal needs. You and your anesthesia provider will discuss an anesthetic plan that uses one or more different types of anesthesia. Plans may include the following. General anesthesia refers to a very deep sleep that prevents you from feeling or remembering any discomfort from the surgery. It is the result of a specific combination of anesthetic drugs chosen specifically for you based on your medical history. It is not unusual for patients to require a breathing tube to assist with breathing, as well as devices to monitor vital signs. Regional anesthesia refers to the injection of local anesthesia into certain parts of the body in order to prevent pain during or after a procedure. Examples of this type of anesthesia include epidurals, spinals, and peripheral nerve block and/or catheters. Certain peripheral nerve block catheters may be taken home for post-operative pain control at home. You may or may not also require general anesthesia or monitored anesthesia care. Monitored anesthesia care, MAC. Your anesthesia provider will monitor your vital signs and pain while administering pain medication and sedative in order to make sure you are comfortable and safe during your procedure. While the depth of sleep associated with MAC is not as deep as with general anesthesia, most patients still do not remember their surgery. MAC may be used along with different types of regional anesthesia. Risks and complications of anesthesia vary according to the type of surgery as well as your medical history. Your anesthesia provider will discuss the risks, complications, and side effects as they pertain to your history on the day of surgery. For safety reasons, please follow all preoperative instructions that you receive from your surgeon and/or the St. Luke's Pre-Admission Testing Center. Pain. Recovering from surgery is associated with at least some pain or discomfort. While it is reasonable to expect some pain, St. Luke's provides a comprehensive multidisciplinary approach to pain management that can reduce your pain and speed your recovery. This may include the use of regional anesthesia, including pain catheters that patients can continue to use at home, non-opioid pain medicine, opioid pain medicine, and referral to our dedicated inpatient pain service. The St. Luke's Pain Service manages regional anesthesia catheters as well as pain medications for patients who have pain that is difficult to control. During your surgery. At St. Luke's, our infection prevention program focuses on preventing our patients from developing infections related to their surgery. Our doctors, nurses, and other healthcare workers follow strict infection prevention guidelines from the Center for Disease Control and Prevention, CDC. The surgery team will do the following: wear a special hair cover, mask, gown, and gloves during surgery to keep the surgery area clean. Clean their hands and arms up to their elbows with an antiseptic agent just before the surgery. Remove any hair that is present in the area where the incision will be made. They will use electric clippers. Keep in mind, only electric clippers will be used for this hair removal. Clean the skin at the site of your surgery with a special soap that kills germs. By following the best antimicrobial stewardship, AMS, practices, we are dedicated to prescribing antibiotics only when they are needed and will avoid giving them to you when they might do more harm than good. If antibiotics are prescribed, be sure to take them as directed by your provider to help prevent complications. In addition to the guidelines above, healthcare workers are expected to clean their hands with soap and water or an alcohol-based hand rub before and after caring for each patient. Before you are discharged, you will receive printed discharge instructions regarding your surgery prior to discharge. If there is a pharmacy on campus, you can choose to fill your prescriptions before discharge. You can expect a follow-up phone call from a nurse to answer any questions you may have about your surgery and to check on your post-operative status. After your surgery, patients can play an important role in preventing infections. Ask family and friends to clean their hands before and after visiting you, either with soap and water or with alcohol-based hand cleaner. Do not allow visitors to touch the surgical site, wound, or dressings. Do not allow your pets to come in contact with your wound. Make sure you understand how to care for your wound before you leave the medical facility. You should be provided with paperwork at discharge to explain how to care for your wound. Always clean your hands before and after caring for your wound. Make sure you know who to contact if you have questions or problems after you get home. If you have any symptoms of an infection, such as redness and pain at the surgical site, drainage from your incision, or fever, temperature of over 101.5, call your surgeon immediately. Locations: Allentown, 1736 Hamilton Street, Allentown, Pennsylvania, 18104. Patients please report to South Lobby to check in. Pre-admission testing: 610-628-8352. Ambulatory Procedure Unit: 610-628-8639. Anderson, Main Hospital, 1872 St. Luke's Boulevard, Easton, Pennsylvania, 18045. For patients having surgery, report to the main hospital entrance and register at the front desk. Pre-admission testing: 484-503-0504. Ambulatory Procedure Unit: 484-503-1430. Bethlehem, 801 Ostrom Street, Borough of Fountain Hill, Bethlehem, Pennsylvania, 18015. If you are being admitted after having surgery, report to admitting in Lobby B. You will then be directed to the Surgical Services Family Waiting Room located on the first floor. Outpatient surgery patients going home that day, report to the Surgical Services Family Waiting Room located on the first floor. Pre-admission testing 484-526-4493 or 4495. Ambulatory Procedure Unit 484-526-441. Minors 360 West Ruddle Street, Coaldale, Pennsylvania, 18218. All patients report to the main registration desk in the main lobby prior to coming to the third floor. Ambulatory Procedure Unit 570-645-8130 or 8130. After 5 p.m., 570-645-8105. Monroe 100 St. Luke's Lane, Stroudsburg, PA, 18360. All patients should report to the main hospital entrance and register at the front desk. Pre-admission testing 272-212-0447. Ambulatory Procedure Unit 272-212-1435. Quakertown 1021 Park Avenue, Quakertown, Pennsylvania, 18951. On the day of surgery, report to the registration desk in the lobby. Pre-admission testing 215-538-4573. Ambulatory Procedure Unit 215-538-4595. Warren 185 Roseberry Street, Phillipsburg, New Jersey, 08865. Eye patients, pain management, and outpatient GI patients report to the first floor of the Roseberry Surgery Center. All other patients, outpatients, and same-day surgery patients, as well as OP Bronx, report to the main hospital and go directly to the second floor reception desk. Before 5 p.m., call 1-908-847-6778. After 5 p.m., call the supervisor, 1-908-847-6570. Information for Medical Alert Bracelet and Jewelry. Sleeve gastrectomy surgery. Do not place NG tube blindly. NSAIDs, aspirin with caution. Or RNY gastric bypass. Do not place NGT blindly. No NSAIDs, no aspirin. Or biliopancreatic diversion. Do not place NGT blindly. No NSAIDs, no aspirin. See page 182 of this manual for more information on medical IDs, or visit med-id.com. Bariatric Surgery Review Quiz. Check your understanding by taking the quiz. Answers are on the next page. Please read each question carefully, then write T for true or F for false on the line next to the statement. Number 1. Diabetes, high blood pressure, back pain, and other ailments relate to obesity are guaranteed to get better after obesity surgery. Number 2. I only need to have the surgery and do not need to change my behaviors in order to be successful with weight loss. 3. In order to keep my meal in my pouch for a longer period and to keep me feeling more full, I should not drink liquids 30 minutes before my meal, during my meal, or 60 minutes after my meal. 4. I will want at least half of my meal to be carbohydrates. 5. In order to be more successful with my weight loss, I should measure my foods, eat 3 meals per day, follow the rules of the pouch and exercise. 6. If I'm feeling well, I probably do not need to take my vitamins anymore. 7. Dumping syndrome can occur if I eat foods high in sugar or fat. 8. 3 very important jobs you will have right after surgery and for the next week are to sip fluids a small amount at a time to reach 48 to 64 ounces a day. Get up and get moving, and use your incentives barometer to keep your lungs clear. 9. Reoperations are sometimes necessary due to certain complications that can occur, like bleeding, a leak in the staple lines, hernias, blockage of the intestines, or other causes. 10. Studies show that going to support group on a regular basis will increase your chance of success after weight loss surgery. 11. NSAIDs, or non-steroidal anti-inflammatory drugs, and aspirin should not be used for pain control and can be found in many over-the-counter medications. 12. If I experience severe shortness of breath or increasing abdominal pain not relieved by pain medication, I should go to the emergency room. 13. It is okay if I stop following up with my surgeon since I am losing weight and feeling good. 14. Grazing or snacking when I'm not hungry will increase my chances at failing with weight loss. 15. There is a risk of death with bariatric surgery, but I also understand there is a risk of death with remaining obese. Bariatric surgery review quiz answers. No peeking before you take the quiz. Number 1. False. Although you reduce your risk of these conditions greatly with having bariatric surgery, there is not a guarantee that you will be completely free from them. 2. False. You must commit to lifestyle changes like exercising, eating the right foods in the right amounts, and at the right time. 3. True. This is the 30-60 minute rule, and you should follow this for life. 4. False. Half of your meal should be protein. Protein keeps you feeling fuller longer. 1/4 of your meal can be a good carbohydrate complex. 5. True. These are things. 5. True. These are things you should do for life to help remain successful. 6. False. You will need to take vitamins and minerals for life. It is possible for your vitamin and mineral levels to be declining and still feel well. It may be much later that you feel symptoms. Always take your supplements. 7. True. You should avoid foods high in sugar and fats to avoid dumping syndrome and to avoid gaining weight. 8. True. You should concentrate on these things for the first week after surgery. 9. True. Know the signs and symptoms of possible complications. 10. True. Get to support group as much as possible. 11. True. Read labels carefully and refer to your list of medications to avoid. Make sure your doctors have this list too. 12. True. We prefer you come to this emergency room, but if you live a distance, you should always go to the nearest one. 13. False. You should follow up with your surgeon for at least 5 years. You should always follow up with your family doctor. 14. True. If you must have a snack, it should be planned ahead of time and should be healthy. You should always eat at a table. 15. True. Know the signs and symptoms of complications.